Welcome back guys to another video of brief lectures. Okay, and in this video we'll be covering infertility. Okay, again I would encourage you all to subscribe for more videos, to keep updated, and check out all the videos in this playlist for a better conceptual clearing. It'll help out a lot. Now, infertility. First you should know the definition and the difference between infertility and sterility. Now, both of them, there is absence of the ability, so there is the inability to conceive or beget children, so the person cannot reproduce. Sterility, yes, the person absolutely cannot reproduce, cannot conceive. Okay. In infertility, it's the same thing, but there's a gap. Okay, the person cannot conceive or has not been able to conceive for 1 year, even after regular unprotected intercourse. Okay, so the person has not been able to conceive even after 1 year of regular and unprotected intercourse. Sterility is just not able to conceive because of other causes. Now, types. Infertility is classified into types. Okay, so there's primary and secondary. It's not that primary is because of some pre-existing disorder and secondary is because of complication of some disorder. No, it's nothing like that. Primary means the person has never conceived before. Okay. Secondary means the person had conceived before, has conceived previously, but now the person is no longer to conceive. Now, the question, that thing you need to be clear about here is, we are talking about conception, we are not talking about parturition. It does not require the person to have had delivered a child. We don't need the person to have had gone full term. We just need the person to have carried a baby. It does not mean that if a person is carrying a child or if the person has already has babies, we are going to reject it. No, the person should either have children, should either have conceived and then led to miscarriage or to abortion or to fetal death. Okay, so during parturition, the person should have conceived, regardless of it being a miscarriage, regardless of it being abortion, regardless of it being a full term. So conceived, so it can either be full term, it can be miscarriage, it can be abortion, it can be a stillbirth. Regardless, if the person has conceived and if sperm and egg fused, got implanted, the person missed a periods, got a pregnancy test, was positive, the person has conceived and fall into the secondary category. Okay, now incidence. Whom does this affect? So we need to look at the male to female ratio. For your surprise, the male contribute 40%, but the females don't contribute 60%. Females as well contribute 40%. Okay, so it's a 40 is to 40 is to 20. The 20 is unknown. Even the latest advancement in science are unable to figure out why this 20% of infertility occurs. Okay, but 40% of the time it's the male, 40% of the time it's the female, which means there's an equal incidence among males and females. Okay, then we have to come to the causes why the person suffers from infertility. A patient comes to you, before treating your treatment you need to diagnose. So before diagnosing you should have that thing in your mind, like, okay, these are the causes by which the person can suffer from infertility. Okay, so causes male causes, female causes. These deal with the reproductive system of that particular person. Okay, the male causes and the female causes, and then we have some extra causes, okay, which have nothing to do with the reproductive system but are more psychological or infection like viruses and drugs. So we'll talk about extra as a separate topic, and we'll talk about male and female depending upon the reproductive system. Now the male causes are divided on the basis of level of testis. Okay, so either it's testicular, or it's post-testicular, or it's pre-testicular in case of males. In case of females, we have to take the level of the reproductive tract. So first we take the cervix, then we go up to the uterus, then the fallopian, then ovary. Okay, so the defect in females, we take it at the level of ascent of sperm, and in males we divide the level based on testis. So either it's pre-testicular, post-testicular, or testicular. Okay, first we look at the males. Okay, so the testis, the penile shaft, and this is the rest of the body. Imagine. Okay, it's a horrible drawing, I understand, but imagine. Now, what are the problems in the body which can lead to problems such as infertility? Systemic causes. Most commonly, systemic causes. Like there is chances of any systemic manifestation like diabetes or hypertension leading to impotency and infertility. So we have systemic causes. But most commonly and more specifically, even it's very rare that diabetes causes infertility, but what's more specific? Genetical abnormalities. Okay, genetical abnormalities are the most common pre-testicular causes of infertility. Example, you have Downs, you have Edwards, you have Klinefelter's. Okay, so all these genetical disorders which can lead to problems. Then there is psychological. Okay, so you have genetical, then you have psychological, of course psychological also, rarely, but yes, it's considerable, and some anomalies of the pituitary. So without the pituitary, there is no stimulus for the secretion of follicle stimulating hormone or Leydig cells, stimulation of Leydig cells and Sertoli cells. Okay, so dysgenesis or improper maturation of the sperms, infertility. Okay, pituitary causes. So higher control, then you have systemic problems. Most commonly you have genetical problems in pre situation, pre-testicular. When you come to testicular, testicular tumors. Okay, get that out of the way. Tumors, of course, we have testicular tumors. Think about genetically, what could possibly be wrong with the testis? Absence of testis, most common. Absence of testis, most plain. If the testis is absent, the person will be infertile. The testis has tumor, the person will be infertile. Again, you have elephantiasis. Rarely, yes, it can lead to infertility. We will not mention that. Okay, and the absence. Undescent testis. So the testis will be in the abdomen cavity, in the chest cavity, somewhere along the line of descent. Because of the increased temperature of the body, even though sperms are being produced, they're dead, unviable. Okay, so absent testis, undescent testis, tumors, and various other things. Then post, absence of penis, penile shaft. Okay, absence. Then phimosis, ephimosis. Okay, paraphimosis. Then you have a very small penile shaft so that it's enabled to deliver the sperm into the female canal. Okay, and obstruction like hydrocele, So those are post epididymis problems, okay, prostate problems. So these things come in post testicular. So pre-testicular, you have genetic, you have psychological, you have hormonal. Okay, testicular, you have undescent testes, not formed, absence of testes, testicular tumors, and post testicular, you have absence of penis, paraphimosis, epiphymosis, phimosis, and all those. Okay, when you come to females, the female tract, we have cervix, uterus, fallopian tube, ovary. Okay, we'll broadly discuss around this 4 broad categorizations. Okay, now the cervix, if the cervical mucosa is not ready to receive, if the cervical mucosa is not properly formed, then the sperms are not going to enter. So that's one of the most common cervical causes. Most commonly they'll be asking questions regarding the uterus, the endometrium. So in the uterus, we have anti-sperm antibodies. So sometimes there will be anti-sperm antibodies formed in the female body which will act against the sperms and kill them. Then you have fibroids. Common. Fibroids are very common. Yeah, cervix, polyps. Polyps are also common. Okay, polyps. So mucosal secretions and polyps, most common cases in case of cervix. Infections also. We'll come to the infections when we deal with PID in the same video. Okay, uterus, anti-sperm antibodies, fibroids. Fibroids, which type? It needs to be intramural. Intramural, most common. Endometritis. Okay, not metriosis, endometritis, inflammation. And we have uniconvate and biconvate type of uterus. Especially uniconvate. Okay, uniconvate leads to multiple abortions. I think that's an important question for your MCQs. Uniconvate leads to multiple abortions. So everything will be seeming fine, but since the uterus is in uniconvate condition. And intrauterine adhesions. Now this is again a very important topic that we have wandered into. Intrauterine adhesions, why do they occur? Okay, a patient has come to you for some procedure and you're doing D&C. Excessive dilatation and curettage can lead to intrauterine adhesions. This is improper method of surgery. Though it happens sometimes, it's not supposed to be. People do go for D&C, but excessive D&C leads to damage to the endometrial layer, leading to intrauterine adhesions. When the intrauterine adhesions occurs, the uterine is blocked, which leads to problems during conception. Again, infertility. Okay, so it does not affect the infertility during which D&C is done. It affects the next conception. Okay, and any impairment in implantation. Now, when we go to the tubal, so fallopian tubes, endometriosis. Okay, endometriosis. Endometrial gland starts growing in the fallopian tube. It blocks the fallopian tube. Okay, then you have infections, though they do occur, and you can have tubal adhesions. Okay, so when we're talking about fallopian tube, they can either be adhesions or obstructions. Okay, and then ovary, we have tumors, very common. Again, just like testes, you have undeveloped undeveloped ovary. Then we have hormonal problems. So you are not getting proper signal from your pituitary, higher levels for the ovary to secrete its progesterone and estrogen. One most common thing which happens is in reproductive age group is PCOS, polycystic ovarian disease. You have to mention it because it's very common. It affects 60 to 70% of the females in reproductive age group, and it can lead to infertility. So be sure to mention PCOS. Highlight this. Yeah, PCOS. And one more thing, in case when we're talking about ovaries, is when we talk about hormones in ovaries is cycles. If the person has everything normal, has no PCOS, everything is normal with the ovary, but the egg, after it's shedding the ovum, if it's not able to maintain its luteal phase, okay, how long do we need the luteal phase? The luteal phase is responsible for secretion of progesterone. Okay, later the progesterone secretion is taken up by the trophoblast, okay, from the embryo. So till the formation of the trophoblast, we need secretion of progesterone by the corpus luteum, and if this fails, then before the egg reaches the uterus or before it fertilizes, we are going to have shedding of the uterine lining, menstruation, again infertility. One important point. Okay, so these are the female causes. So cervix, you have mucus problems and polyps. Uterus, you have antisperm antibodies, fibroids, endometritis. Uniconvate and biconvate uterus. Fallopian tube, you have adhesions and obstructions. So endometriosis, tubal adhesions. You have ectopic glands and all those. Ovaries, you have tumors, PCOS, most common, and you have dysgenesis of ovary, hormonal imbalances and all that, and infections. For all of these, okay, most commonly cervix, uterus, even rarely fallopian tube, you can write infections. What are the most common infections? Candidiasis, yes, but more specifically we should talk about pelvic inflammatory diseases. Okay, pelvic inflammatory diseases. Most I'll just brief about it. Pelvic inflammatory disease is caused by two most common organisms. Okay, most two common causes of pelvic inflammatory disease. If that's the question, then first should be Neisseria gonorrhoeae, Chlamydia trachomatis. Two things. So in brief. We'll go to the other causes. So we saw about the male causes, we saw about the female causes, then we'll go to the other causes. We have psychological. Psychological always plays a role because 20% is unexplained, so might as well put psychological in there, right? Okay, timing. If the person has been trying regularly for 1 year without protection and the intercourse has been failure, because they have to match it with the cycle. Okay, if they do it during the time of ovulation, it's going to fail. You have to do it around the time of ovulation. During the time of ovulation, not so much suggested. Around the time of ovulation, good. And the frequency should also be adequate. Okay, now body weight. Conception occurs a problem in females in both extremes. So even in obese females, we are going to have problems, even in underweight. So what's the common disease which causes fluctuation in body weight, and we see most commonly in women? Thyroid problems. Okay, so rule out thyroid problems. And mumps causes orchitis. And then we come to toxic. We have drug induced. Most common, cancer chemotherapy. Okay, chemotherapy, the drugs in chemotherapy, if you saw the video on pharmacology chemotherapy, they aim at the cells which are rapidly proliferating. Okay, that's because that's what tumor cells do. Tumor cells grow at a very fast rate. So what do cancer chemotherapy do? These drugs aim at the cells which are growing at a very fast rate and they affect them. One of them are cancer cells, but there are so many other cells in our body which grow at a fast rate. For example, our skin grows at a very fast rate, our hair grows at a very fast rate, our blood, reticular endothelial system, the synthesis of blood happens at a very fast rate, and even the sperm grow at a very fast rate because they're under continuously dividing. So that's why in case of cancer chemotherapy you see hair loss, because the fast growing cells, for example the hair follicles, are affected, killed, and see alopecia. Most of the time it's reversible. Yeah, and you see destruction of fastly dividing cells. For example, you see orchitis, okay, and you see the lining of the GI, that's also affected because that's one of the fastest growing cells as well, and that's why because of gastric irritation you have vomiting in case of cancer chemotherapy. Side point for you. And lead poisoning, pesticides, okay, pesticides, lead poisoning, toxins. Another common thing is alcohol, smoking. So smoking commonly done by people and is also associated with, they have linked it with infertility as well. So, and IV drug use. IV, actually all types of drug use, drug addiction, alcohol addiction, smoking, lead have all been implicated in infertility. So we finished what definition, we finished the types, we finished the causes, we finished the incidents, and now we look at, I think the video has been going on for long. Yeah, we look at how to achieve normal conception. A patient comes to you, you ruled out the cause, you did a diagnosis. If the diagnosis is treatable without any intervention, if the person can achieve normal conception, the following criteria have to be met. The vagina should be able to accept the sperm. This is in females we're talking about now. Okay, so it should have a good mucosa, there should be no obstruction, there should be proper intercourse. Okay, so if the person has not, in some cases a female comes to you and you examine, the person has been having intercourse but the hymen has not been ruptured, so improper intercourse is suggested in such case. Okay, then mucosa and all this. Then hormones, again we talked about hormones earlier. There should be proper signaling from your pituitary centers and the ability of the corpus luteum to maintain the luteal phase. Two things, okay, that's important. And immunology, the person should not have anti-sperm antibodies. When you look at the male causes, what criteria the male should fulfill so that he is able to conceive normally? He should have normal anatomy. Okay, so in case he has a very short penile length, he will not be able to deposit. If he has phimosis, ephimosis, paraphimosis, he will not be able to deposit. A large hydrocele, he will not be able to deposit. So anatomically should be well. Sperm count and motility are to be taken into consideration, and psychology. So these are the few criteria which should be fulfilled by males and females if they are to conceive normally. Now the treatment and management I'll be taking in the next video because I think it has gone on for so long. Okay, again I hope it helped you guys. Subscribe for more content to stay updated. I'll see you in the next video.